This is our community proposal presentation by Melissa, Marissa, Tracy, and Justin.
Guys, to start off, we'd like to start by showing you a video that we found that we find super impactful and kind of sets the stage for the importance and the emotion attached to attempted suicides by adolescents in the state of Colorado, specifically the Denver, Colorado Springs metropolitan area. This video is about 3 minutes long, so we hope that you take the time to just really listen and feel what we did from this.
A newly released report is calling youth suicide in Colorado a public health crisis.
And tonight, as the state releases alarming new numbers, a Colorado couple sits down with Denver 7's Jackie Crea about their son and the battles he faced. And she joins us now here in the studio. Jackie?
It's impacting our kids, and you may not even know it. The state spent the last year studying suicide rates in Colorado and found between the ages of 10 and 18, more than 815 females were hospitalized because of a suicide attempt. For males, nearly 250. Nick Bales, an Arapahoe High School student, took his own life in September, and tonight we sat down with the boy's parents.
I think, unfortunately, we're all part of this club.
On the outside, it seemed picture perfect. Handsome, athletic, popular, 17-year-old Nick Bales seemed to have it all.
The assumption I made was that because of the life that he was showing us, that he was getting better.
Nick had struggled with anxiety and depression since the 6th grade. His parents, Will and Maria, went to therapy with him, tried different schools and medication, and in his senior year, it seemed like he had turned a corner. He got straight A's for the first time and had even started his own clothing line called BTR. But in September of last year, he took his own life.
My worst nightmare came true. Nick and I talked about it. He promised he wouldn't do it. And it was just a nightmare. A nightmare that will never leave us.
Just a few days later, Nick's friend and classmate at Arapahoe High School would also commit suicide.
It was just a wake-up call to create awareness that this needs to stop. I mean, these kids are seriously struggling.
She's right. In Colorado, from 2015 to 2017, there were 222 suicides by people between the ages of 10 and 18 years old. In the state's recent study, reasons for teen suicides included anxiety about failing, social media and cyberbullying, and a lack of connecting to a caring adult.
It seemed completely surreal, and I still have those same feelings today. Or I'll sit on the couch, I'll wait for him to come home.
In the few months since Nick's death, Maria has taken her message public, speaking at Nick's high school, trying to help push the community to take a step back and talk to their kids, their students who deal with the pressures of school.
I wished I had somebody who would have spoke to us and talked to us and tell us that when somebody is suffering from anxiety, depression, mental illness, that the little signs, those little subtle things are a big deal.
If you need help or know someone that does, you can always call the National Suicide Hotline, or the Colorado Safe to Tell Hotline is also a place to voice concerns anonymously. This past school year, there were more than 2,000 suicide intervention tips. Reporting in the studio tonight, Jackie Crea, Denver.
So starting our presentation, we really wanted to lift up the voice of the community. We felt that it was very strong in emotion and background showing that video. It just demonstrates the destruction that teen suicide has had on the community and the effect that it has on families. The other thing that we wanted to highlight was the suicide contagion that is basically mentioned in that video on how Nick's friend committed suicide about 2 days later. This slide right here is from another news report back in 2018. The girl pictured, her name is Kristen Vard. She's 19. She moved to Colorado Springs in 2007. And from 2007 until 2018, she lost 10 friends here in Colorado Springs. Each one of those bracelets on her arm is a name representative of those friends. 2 of those 10 friends had died by suicide. One of the things that Kirsten really highlighted during her interview was that The motivation behind her friend's death included bullying, violence, the struggle to belong, and also the sorrow of forced to go on living without friends that had passed. This also contributes to the suicide contagion with teens not being able to process their emotions of losing somebody that's so close to them. 116 children in the from the El Paso County Coroner's Office from 2015 to 2018 were identified as suspect. Of those 116 investigations, 44 of those were determined to die by suicide. Kirsten also stated in her interview that she refused to consider any kind of formal counseling because she didn't feel that it did any good. A lot of the expressions that these teens a lot of the emotions that the teens are expressing are a distress for grown adults, and school counselors actually fall to the bottom of the list when they're asked to identify people that they trust. The school site counselor for District 49 at the time of this interview stated that rather than acknowledging it, kids seem to be trying other tactics such as denial, distance, and avoidance. And in quotations, feeling is not something anyone wants to do anymore. And I think that is bleeding down into our youth. To them, it's just like, well, it's just another thing that happens. They've become numb, they've become distant. Kirsten herself has experienced extreme forms of bullying, where she was told on social media by fellow students to go kill herself. We already dug a grave for you, just show up and we'll bury you alive. These feelings, these emotions, these statements combined with surviving and recovering from the loss of friends have caused Kirsten and other students within the District 49 school district to really suffer. And the school district is basically at a loss at this point on how to connect with these students. During the last 2 years, instead of tracking the COVID cases that have come through District 49, they've been tracking the suicide rates. We just wanted to highlight these two stories here specifically in the Colorado Springs area to give two different perspectives, one from families and then one from the actual teens that are experiencing this, because these are the demographics that we're really truly looking at, is the teens' experiences and what's contributing to these factors. Two slides that we did not create for this out of respect. One for me and my son personally, is I'd like to share a personal story of loss over the last couple of years and experience. My son's sophomore year is when COVID hit, and during that time, within the first 2 weeks, he had a friend. His name was Eduardo. He was on the marching band with my son. He was 16 years of age at that time, hung himself within the first 2 weeks of being COVID restricted at home. He was an outstanding student. He had been a friend of my son's since the 7th grade, and watching my son go through that process, not only trying to be there for his family, for Eduardo's family and understanding them, but also trying to be there for my son while I was watching him grieve through this process was really hard. It's a very difficult thing. And that's why teen suicide is more than just a local issue where it's not just the family, it really is a community involvement. My son, along with his other classmates, were involved in this grieving process, and it took a considerable amount of time and effort for my son to even be able to talk about it because it was so difficult for him to process. The other thing that we wanted to really bring to attention was the lack of information and research that we found on the Indigenous population here in the Colorado Springs area. In the Denver metropolitan. So Colorado Springs and Denver, about an hour away from each other. There are 32 identified reservations within that area. None of them were presented in the research that we found or on the news media. So we just also wanted to make sure that we highlighted that the Indigenous population is severely impacted by teen suicide. 20% more Indigenous people commit suicide or attempt to die by suicide compared to the general population. A lot of that has to do with funding that's not available or lacking. And then the other issues here in the Colorado Springs, Denver metropolitan area is that many of these indigenous populations do not live on the reservations. They're living outside, significantly further away from accessing resources that are only available to them on the tribal reservations. So all of these contributing factors should be considered for future research and just being culturally inclusive.
So some background information on our subject. 31% of teen suicide victims are male in comparison to the 17% national average. Globally, suicide is the second most common cause of death among young people between 15 and 24. More teenagers and young adults die from suicide than from disease or sickness. Each day in our nation, there is an average of over 3,703 attempts by young people between the grades of 9 and 12. 4 out of 5 teens who attempt suicide have given clear warning signs. The 2019 Youth Behavioral Risk Factor Surveillance System from the CDC shows that 18.8% of high school students considered attempting suicide and 8.9% actually attempted suicide. And the cost of suicide attempts in the United States in 2019 was estimated to be about $70 billion. The information that we got, we believe is reliable because it came from dependable sources based on strong evidence. These resources are the Jason Foundation, National Institute of Health, and the Office of Suicide Prevention's annual report, which is a government entity, the American Academy of Child and Adolescent Psychiatry, and the Health and Human Services, just to give a few examples.
So for our power analysis, we're going to go over the power. So to describe who has power in the community. So for our specific topic, schools and the school board, they're the individuals who are able to teach education or provide educational classes for parents for awareness. Also, state or county legislatures can hold power because if they don't pass bills or they don't provide funding for such as preventative topics or even being able to assist families during this time of need, they're able to dictate how families interact with the local resources and communities and what they're able to access and what they're unable to access as well. Another power analysis is through the court system. Mental health providers as well. If they aren't taking insurance or specific insurance, families don't have access to specific mental health entities. So a one-on-one counselor, if they don't have access to insurance as well, going through like a 5150 hold through a hospital as well, they're unable to have that evaluation to deem themselves able to go back into the community or even be able to seek the assistance that they do need with a one-on-one counselor to talk about domestic violence or abuse within the home themselves. And then parents of at-risk teens aren't even getting information, as you guys heard in the video from one of the victim's mothers, that she wished that she had some sort of resource that somebody would have actually provided her information or had this conversation with her or to find the warning signs. And then, as I mentioned as well with hospitals and the healthcare system, not having access to adequate care or even kind of pointing families in the right direction to make sure that this is preventable. Another power dynamic is teens don't necessarily have a voice in the power dynamic. They're told what to do, when to do it by families, by schools. They're kind of told how to do things, where they're going. I don't really want to. Well, we have to do it. So this is part of life. So even within that, the children who are like facing domestic violence or facing depression or facing anxiety or any other mental health crisis are not necessarily being heard. They're not able to use their voice. And so for them, they're at this breaking point where they're not receiving the adequate care for counselors or teachers or mentors. They're not also possibly receiving it within their family systems, within their friend support. And even if they do have a friend support, not all the time are the friend support adequate in being able to provide the care that they need or know how to point their friend into a healthy direction. Another resources that are not in the community currently that we came up with was the inadequacy of mental health resources. Colorado is a state that is actively trying to provide additional resources for families and in the process of passing laws and bills for that. but currently and during this time, they're kind of in this transitional process. So not having adequate resources for students currently, or even teens who are attempting or have attempted or are on kind of the fence of whether or not they want to fulfill that. There's also gaps between available resources and access to services, like Melissa said previously, especially for any Indigenous populations. Sorry, my niece just walked out. My dad's not watching her, so she's right here. So I stopped. So I'm going to keep talking. If she interrupts, I'll restart. I'm sorry. And then funding so that kids are not held responsible for paying for mental health services, especially when they are seeking help independently of their parents. Having access to jobs, having access to pay for that, and then also being able to go seek a counselor and using parental insurance as well. And some of the institutionals that have impact on the community would be also government, local, state, and federal, like I mentioned, some of the policies that are currently in place. Also for our non-exploitative process, as you mentioned earlier, honoring cultural differences and religious beliefs surrounding suicide and death. Not all cultures believe in suicide or view suicide similarly. And so being cognizant of those communities that not always see suicide in the same light or as accepting of that, making sure that we use preferred terminology and language of the client and how they choose to identify. Personal perspective from community members. As you guys saw at the video previously, we used a community member who's experienced it. Melissa also shared her community experience, and so we wanted to elevate and lift those voices so that way we're not coming in a power dynamic and being able to be like, well, these are the stories of these individuals and exploiting them in any type of way. Having social workers being understanding of the stigma around suicide and to help kind of mediate that stigma. So going to classes in the school system, going to community board members, having district meetings, and making sure that it's something that is talked about and not necessarily something that is taboo or people are afraid to have that conversation, as you've seen the impact of people who are living it. Help advocate youth for what they need and what they, in terms of their own mental health. As we mentioned earlier, teens don't always have the power in kind of the support that they need. And then lifting the voice of the community, like I mentioned as well, and then making sure that we have trauma-informed care in the hospital settings as well. The next one is talents and skills of people. So making sure that we have strengths and protective factors. So family support, making sure that the needs of the family are being met, especially those who are experiencing loss or who are dealing with a child who's attempted but has survived. Also school support, making sure that the schools have the resources to be able to assist in providing those prevention plans, having counselors or clinicians coming and talking to students to make sure that that is readily available for them. Mobilization, as we showed earlier, there's multiple foundations that are being utilized to be able to help spread the awareness and kind of start passing laws and help with funding. Community services, early childhood prevention, counseling, peer support, hospitals, like I had mentioned. Universal prevention plans for suicide, as we'll talk about as well. Colorado is one of the leading states for providing suicide prevention for funding and passing kind of progressive laws for that. Political, state, local, and federal backing. House Bill 1120 is one of the major ones that was passed to allow teens to seek out mental health without having to have consent from their parents. And then local advocacy, moral outcry, and petition and activism as well. And then the strength of a community coming together to want to be able to make this change, as you saw the news outlet also getting involved to help spread awareness.
Okay, so some of the community programs and national organizations that have been organized to address the really difficult issues around suicide and suicide attempts and kind of address some of the power dynamics as well. I'm going to mention, we found a lot of resources, but I'll mention two of the local community resources in Denver, and then mention a couple of the really standout national organizations. The first Denver area group is called the Hope Group, and they provide professional, supportive, peer-led services to individuals impacted by suicide, including suicide loss survivors, suicide attempt survivors, individuals who have ongoing mental health issues or suicidal ideation. They help family, friends, caregivers, and individuals who have attempted suicide. The different types of support that the Hope Group offers are support groups to both adults and teens. They also have 7 to 8 week psychoeducational workshops for adults and teens who are loss survivors or attempt survivors. And then they also have trainings for peer counselors for suicide prevention and intervention. The second group in Denver is called the Second Wind Fund. And this program is really an interesting one because it's trying to address the problem of kids feeling comfortable with reaching out and getting the help that they need. So what they do is they match children and youth ages 19 and younger who are at risk for suicide and don't have the means or adequate insurance for necessary mental health treatment with licensed therapists in their local communities, either in person or through teletherapy. And the Second Wind Foundation can help narrow down a list of therapists who meet the child or teen's needs by helping them bypass the whole kind of confusing healthcare system. And this is a really important aspect because that is a huge barrier to children and teens seeking help when they need it. So at the government and NGO level, there are 2 organizations that stood out. The first is the Jason Foundation, which is a nationwide organization that is dedicated to preventing the silent epidemic of youth suicide through educational awareness programs that really help young people, educators, youth workers, and parents by providing tools and resources to help identify and assist at-risk youth. So some of their main programs include resources that are donated at no charge to any school, youth organization, or community to help prevent suicide and work on suicide intervention. The Jason Foundation's work includes student curriculums, professional development, in-service trainings, parent seminars, and community seminars. As a side note, the Jason Foundation is partially funded by Acadia Healthcare, which is a large behavioral health service provider that has many different facilities all throughout the United States. And so Acadia funds Jason Foundation, and they also provide things like phone responders, office space, group meeting spaces, gathering places for teachers, counselors, and community members. The other government organization is called Sources of Strength. And this is a nationwide suicide prevention program and one of the first programs that uses peer leaders to enhance the protective factors associated with reducing suicide at the school population level. The model that the Sources of Strength has been adopted by the city and county of Denver, and they've organized a youth mental health summit called We Got This, which is scheduled to take place in May of 2022. And this is, I think, one of Denver's attempts to really meet the needs of this particular community. So the We Got This initiative has outlined the goals for action that reflect the layers of the ecological model, which is the model that we chose to look at this issue through. So they look at coordinating efforts between the community entities and recognition of the factors and forces that contribute to teen suicide, all the way from the micro level through the macro level. Some of their goals include providing internal and external resources such as coping skills, therapy options, suicide prevention, and community help. Their goal is to help build youth relationships with their peers because they feel that that's a protective factor in this issue. Offer youth hope and inspiration amid all the social, economic, environmental, political pressures, and now including the pressure of COVID. provide students and community members access to meaningful information and resources to support youth suicide prevention in the community. Their goal is to reduce the stigma related to mental health and substance abuse, which is a huge thing, and it was talked about in the video in the beginning. That I think nobody talks about it, and people don't understand that there are real risks related to depression and anxiety. So their goal is to help remove that stigma. Their goal is also to help remove the stigma as a barrier to accessing services. And this is a huge piece of the puzzle. Another goal is increasing empathetic response and decreasing adverse response to behavioral health conditions and occurrences. They also want to create an interagency task force so that they would collaborate between sectors and develop a stronger and more efficient approach to preventing suicide. And then they would create a peer-to-peer mentoring program called the Hope Squad. And the Hope Squad would develop a partnership with the Denver Public Schools and Denver Public Health and Environment to increase awareness and skills related to suicide prevention through this peer-to-peer mentoring support program. So there are quite a few really good programs going on in Denver as a response to the high rates of teen suicide. And I think that these programs have been proactive in addressing this problem.
Okay, so in analyzing the economic assets available for these programs, we took a top-down macro approach, and where we analyzed the different power dynamics at play. So beginning with lawmakers and policymakers, they affect how behavioral health care is provided, as well as many other areas that affect people's well-being, including housing, education, the workplace, access to substances, and such as alcohol, and access to guns. One of the largest things to come from lawmakers and policymakers in the last several years regarding teen suicide was Colorado House Bill 1120, which effectively lowered the age of consent from 15 to 12, allowing teens to seek mental health services without parental consent. This article is currently being amended with new requirements and funding available. One of the major funding sources that was also available from this bill was that a suicide prevention or awareness library had to be created at the state level and housed there for accessibility for all schools, for all educators, and individuals seeking information on how to acknowledge, access resources, and basically address issues related to teen suicide. Moving down the spectrum, we have Denver Social Services, housing and healthcare professionals, and behavioral health professionals work directly with individuals and families to treat complex behavioral needs. Then we have our community organizations. Businesses and places of worship play a role in well-being. It may be as simple as having a place to go, providing mental health first aid classes, posting flyers about mental health and suicide prevention in the community. Classes such as art, yoga, karate, all of these other things that give these teens a place to go and really connect with their sense of being, a belonging, and person. And then we roll down to employers who provide access to behavioral health services through healthcare plans. They create policies that support better mental health, such as paid family leave and medical leave for employees during affected mental health issues. Additional support for employees returning to work after medical leave. Employers actually play a very integral role in how we address mental health issues, not only in the state of Colorado, but nationally, with time off allotted, time for the grief process, and support services available during and after the event. The Colorado Department of Public Health and Environment, the Office of Suicide Prevention, is a state-level infrastructure that employs the use of empirical research to offer resources and funding opportunities for suicide prevention. They have hired navigators to connect people to behavioral health resources like counseling and other social support services. Navigators are also something that I've seen at the micro level, even during our own clinical practices, where we will have our Rolodexes of available resources within the community, state, and federal levels. The Colorado National Collaborative is a funding opportunity that's currently available this year through May of 2022. The Office of Suicide Prevention, in conjunction with the Colorado National Collaborative, is offering $100,000 grants to support local coalition building and infrastructure for the CNC. The CNC is a collaborative of local, state, and national prevention specialists and public health professionals. These individuals work with health and social service agencies, nonprofit organizations, government, academic, and business organizations. They also work with the local Colorado residents to identify, implement, and evaluate successful state and community-based strategies of suicide prevention in Colorado. The goal is to identify local partners in priority counties such as El Paso, to develop and implement strategies that support a public health approach to suicide prevention. The Colorado Health Foundation, whose mission is to improve the health of Coloradans. Their framework is built on the idea that it is time to act on mental health interventions now. We all have a unique and important role to play in improving the mental health of our residents. Partnered with the Denver Public Health and Environment to create the Road to Wellness framework, a strategic plan to improve behavioral health in Denver by removing barriers and improving systems for advocacy, for change, all while promoting equity in the healthcare system. The system works by pooling resources between city partners, community organizations, and private sectors to reach interconnected and overlapping goals. The system was created in response to Denver Mayor Michael Hancock's charge to the Behavioral Health Steering Committee to hear the voices of those experiencing poor mental health, understand the scope of the issue, and build a framework that could bring us together to improve the mental and emotional well-being for all Denverites. Since this call to action, more than 100 people have responded, 50 organizations have participated. The Children's Hospital of Colorado has multiple campuses throughout the state. It is currently expanding a local community asset here in Colorado Springs area, expanding its wraparound services for children struggling with mental health needs. The expansion here in Colorado Springs will have a daytime pediatric partial inpatient program and is expected to be completed in the summer of 2022. Kids spend the day with their specialists to receive the acute care that is needed to treat their mental health needs. And then at night, they are reunited with their families so that they can eat dinner, sleep in their own beds, and communicate anything that's been learned during these processes. The next day, they return to the inpatient program, partial inpatient program, and receive the same level of care. We as a group really felt that it was important to lift the voices up of the teens that are involved in and experience severe trauma due to cyberbullying, in-class personal bullying. The LGBTQ plus community is at a specific detriment when it comes to these aspects and are at an increased risk, almost 20 times the amount of other demographics within the Colorado Springs, Denver metropolitan area as being susceptible to teen suicide. My group and I would also like to thank you for watching our presentation. We hope that you may consider the issue of teen suicide in your future practices and advocacy work. And we really just wanted to highlight the importance of listening to these marginalized communities, teens in particular, don't have a voice. Like Marissa had mentioned previously, we just expect teens to perform. We expect them to perform in school. We expect them to perform at home. We expect them to perform to social expectations without listening to their needs. So we really, really, truly hope that this presentation highlighted the need for listening, for being present, for being empathetic, and just being a voice for those that have no voice. Thank you for your time.